Professor Mohty, good evening. Mr. Chairman, good morning. You are the new EBMT president, and you will have a tremendous challenge in front of you, as it was highlighted by Professor Madrigal during the opening ceremony. During the last 4 years, close to 500,000 transplantations were performed, 150 peer-reviewed articles were published, 1,000 impact factors were credited to the EBMT papers. What can you do, and how can you do better?
Well, thank you very much. Indeed, it's always a pleasure to be with you for this annual traditional interview. And as you have just summarized, the transplant community and the transplant activity is doing rather well, thanks to the efforts of all EBMT members and all the physician, nurses, and other stakeholders involved in this field. Indeed, the transplant activity is increasing worldwide, and we are fortunate enough to know that more and more centers are currently engaging in the transplant. New centers are opened almost everywhere, because as you know, stem cell transplantation, whether autologous or allogenic, remain the standard of care or the only curative option for many hematological and non-hematological diseases. So from that perspective, I think we will have to pursue this effort to favor access to transplant to the majority of patients who are in need of stem cell transplantation. We would like also to push further the accreditation process. I think access to top quality care is something important, and the transplant community has been a pioneer in this field to provide. So we'd like to provide access to transplant in the best and optimal conditions. We at EBMT have already published, for example, that the JC accreditation is something that is correlated with outcome improvement. So we're currently working on some projects which facilitate access to accreditation, or at least help centers to commit on the accreditation process. We would like also to involve, because that goes together with the quality of care, in educational activities. So in addition to our annual meeting, and you have just noticed that this is absolutely a terrific and outstanding 40th anniversary meeting, where we had a record of participants, an absolutely wonderful scientific program. So we would like to engage in other educational activities, because there is a very strong need in the community to have some focused and dedicated educational activities, and we believe this is part of our mission. So by the end of this year and in 2015, you will see many initiatives from that perspective.
You will expand by increasing the number of centers accredited. You can expand also moving outside of Europe, which is already done. And do you think also to expand by federating within the EBMT or around the EBMT, not only people dedicated to transplantation, but also people involved in new therapeutic approaches? Because as it was also highlighted at the beginning of the Congress, transplantation is not something which is a standalone procedure, but it's part of therapeutic strategy and a therapeutic algorithm.
I think you summarized the situation very nicely. First of all, EBMT, it's not only Europe, it goes beyond Europe. We are more than 55 countries worldwide, more than 600 transplant centers worldwide. So our commitment goes beyond Europe. I would say we are at the era of transplant without border. So that's for sure. Then another important aspect, I think these days, the debate is not transplant versus no transplant. This is not an interesting or useful debate. The question these days is how to integrate transplant as part of the whole full package, whole treatment strategy. And from that perspective, EBMT is committed to cover the whole field. So you will see more and more that our educational activities, our annual meeting is going to address transplant and non-transplant approach. Our philosophy is quite simple. The idea is how to optimize the treatment for an individual patient at a given time point for a given disease. And from that point of view, it's going to be how to integrate transplant, but also all other therapeutic approaches, all other novel agents. So there is no separation. Our main goal, main focus, to improve patient outcome. And when I say patient outcome, I believe it is survival. That is definitely the key and primary objective we are going to push forward.
So this year, before the start of the Congress, the registration was close to 5,000. I'm sure next year in Istanbul you will exceed the 5,000 participants, and I would like to propose you to have this type of discussion next year on the Asian side of the Bosphorus.
Well, as you know, you are always most welcome, and we'll definitely be there and have some good time together. Thank you.
Thank you very much.